So hey everyone, welcome to Corvette. So today in this particular lecture, we will be discussing about the penicillin, right? So if we talk about the penicillin, it comes under the beta-lactam group, right? And along with the penicillin, there is also cephalosporins, right? Which also comes under what? The beta-lactam group. Why they are coming under the beta-lactam group, we'll be discussing it later on while we will be discussing about their structures, right? So we'll be discussing it later on why both of them are coming under the beta-lactam group, right? So let me start with the general information regarding the penicillin. Okay, so if we talk about the penicillin, we all know what was the history of the penicillin was that the Alexander Fleming, he left out the plate of the staphylococci, and when he came back, he watched out that there is a mold known as the Penicillium notatum, right? And that particular mold had inhibited the growth of the staphylococci, right? And we had discussed in the general part 1 also that how Chain and Flory has just extracted that particular penicillin, right? So we had discussed that particular thing in the general lecture 1 also. And if we talk about the current scenario, that in the current scenario, the Penicillium chrysogenum, this particular mold, this mold is currently used for commercial preparation of the penicillin, right? Earlier the Penicillium notatum was used, but now it's the P. chrysogenium which is currently used for the commercial preparation of the penicillin, right? Because we have to prepare the penicillin in the large scale, and this particular P. chrysogenium is the mutant strain, right? So moving forward, I had discussed the first 2 points. Now coming on to the structure, and if we talk about the natural penicillin, there is penicillin G, which is the benzyl penicillin, right? It is also known as what? The benzyl penicillin. The penicillin G, it is also known as what? The benzyl penicillin. And if we talk about the properties of the penicillin G, which is also a natural penicillin, so it is thermolabile and acid labile, means it is quite susceptible to the high temperatures and acid. Okay, it is susceptible to what? The high temperature and the acids, right? If we talk about how what is the composition of this particular penicillin G is, so it is made up of what? It is made up of 6-penicillinic acid and benzyl side chain, right? So coming on to the structure, so the structure is quite important of the beta-lactam group, both of the penicillin and the cephalosporins. So if we talk about the structure now, so there is 3 things that you have to notice, right? First one, there is a thiazolidine ring. Okay, in the structure of the penicillin, there is what? A thiazolidine ring, right? Next to the thiazolidine ring, there is a beta-lactam ring. This particular beta-lactam ring is present in both the penicillin and what? The cephalosporin, right? This particular beta-lactam ring is present in both. That's why they are coming under the beta-lactam group. Okay. Now, if we talk about the further structure, so there is another side chain which is connected to the particular beta-lactam ring by the amide linkage. Okay, so this is the structure of the penicillin, right? So if we talk about how the salts of the penicillin has been formed, so the salts of the penicillin has been formed by the replacement of the hydrogen atom from the COH group of the thiazolidine ring. Okay, so the salts has been formed by the replacement of the hydrogen atom that is there in the COOH, mean the carboxylic acid group that has been attached to the thiazolidine ring. Okay, so when you are going to replace that particular hydrogen atom, you are getting a more stable and soluble salts, right? Because it is necessary that the drug should be soluble and stable in the biological fluids, right? So that's what all about the structure of the penicillin. Okay, so if we move forward now, if we see, right, you have to see that if we are going to treat the penicillin with the amidase enzyme, so it acts on the amide linkage. I had shown you where was the amide linkage is. So here's the amide linkage. Okay, so the amidase will act here. Okay, and it will break it. Okay, it will break the structure of the penicillin, and it will lead to formation of 6-amino penicillinic acid, right? And if we are going to treat the site A, where was the site A? The site A was at the beta-lactam ring. So this is the site A, which is in the beta-lactam ring, right? So this is the site A, which is present at the beta-lactam ring. Okay, so if you are going to treat, see, there are two type of enzyme. See, under the beta-lactamase. Okay, so the beta-lactamase is produced by what? The bacterias. Okay, so the beta-lactamase is prepared by what? The bacterias. So the beta-lactamase, you can have an example as penicillinase and cephalosporinase, right? Both of them. Okay, what's the function of the beta-lactamase is that they act on the site A. They act on the site A of the beta-lactam and will lead to the breakage of beta-lactam ring, right? So what happened if there isn't any breakage to the beta-lactam ring? So the antibacterial activity of penicillin will be lost. Okay, so if there will be any alteration in the beta-lactam ring of both the classes, penicillin and the cephalosporin, I'll discuss the cephalosporin in the next class, but it is for both. Okay, so if there will be any alteration made in the beta-lactam ring, okay, so it will be leading to what? It will lead to the loss in the antibacterial activity of both the drugs, both in the penicillin as well as in the cephalosporin. Okay, so that was all about. And after the breakage by the penicillinase, it will lead to production of what? It will lead to the production of penicilloic acid. Okay, and the antibacterial activity would be lost. Okay, so it won't be of any use if the beta-lactam ring of the penicillin is going to break, right? If we talk about the spectrum, it is mainly effective against the gram-positive and also against few gram-negative. And there are some classes of the microbes like virus, fungi, rickettsias, chlamydia, and majority of the gram-negative that are not susceptible towards the penicillin. Means they aren't going to respond towards the penicillin. The penicillin is inactive towards these classes of the microbe, right? And the effect, as I had told you in the sulfonamide, that the sulfonamide are going to be affected, or their efficiency would be going to reduced in the presence of blood and the pus, right? But in the case of the penicillin, the effect and the efficiency of the penicillin, it is going to be unaltered. Okay, there won't be any change in the antibacterial activity of the penicillin in the presence of pus or the blood, right? So the bactericidal concentration is about the 0.5 U per ml, right? And the extended spectrum, when we are going to study about the classification, we will see about the extended spectrum too. Okay, so there we will be noticing about that it will be going to have a broadened spectrum, right? Generally what happens that the penicillin is targeting majority the gram positive, right? But when we are going to study about the extended spectrum, we will see that they are acting on both the majority of the gram positive as well as the gram negative, right? So let me move forward on the classification. So if we discuss about the classification, it could be divided into two, the natural and the synthetic, right? If we talk about the natural penicillin, so under the natural penicillin, there will be the sodium and the potassium salt of the benzyl penicillin or the penicillin G, right? But there isn't, I told you earlier also that the penicillin G is what? Thermolabile and acid labile. Okay, so when we are going to give the your penicillin G orally, obviously in the GIT there is an acid, you know, HCl is there, it will be going to inactive, right? So the penicillin G is going to be inactivated under the presence of what? Under the presence of any acidic pH, right? Because it is acid labile. Okay, so the duration of action for the penicillin G is about 3 hours. Okay, so if we talk about the springly soluble penicillin, okay, G or the benzyl penicillin, so there are, it's the combination where we are getting that there could be what? Procaine penicillin G, or we can have benzathine penicillin G. Okay, both of them aren't given through the intravenous route. we do not prescribe to give the penicillin G with the procaine and the benzathine salt, that they shouldn't be given what, through the route IV. Okay, IV route isn't prescribed for both them. Okay, so if we talk about the onset, okay, so it'll take 6 to 8 hours, and the duration of action for the benzathine penicillin G, it's about 1 week, and the duration of action for the procaine penicillin G, it's about what, 12 to 24 hours, right? Okay, so the incidence of hypersensitivity is more common with the procaine penicillin G. Okay, it is common with the procaine penicillin G, that we will discuss in the adverse effect too. Okay, so talking about the semi-synthetic penicillin G. Oh, sorry, semi-synthetic penicillin. Okay, so if we talk about the semi-synthetic penicillin, we could divide it into three divisions. First one is the acid-resistant penicillin. Okay, second is the penicillinase resistant, means they aren't going to be inactivated by the penicillinase enzyme. Okay, they are not going to be inactivated by the penicillin enzyme, right? So the second class is not susceptible towards the penicillinase enzyme. Now the next class, which is the third, is the extended spectrum of the penicillin, which will further divide it into the four. Okay, so if we talk about the acid resistant penicillin, so it's the penicillin V, which is also known as phenoxymethyl penicillin. Okay, so the penicillin V, what's the disadvantage of the usage of this particular penicillin V is that it can be destroyed in the veins. Okay, so it would be destroyed in the venules, right? So next is the phenoxyethyl penicillin or the phenethicillin, right? So coming on to the next, which is the penicillinase resistant. See, these were also acid resistant, but not penicillinase resistant, right? They are acid resistant, but not penicillinase resistant, right? But in the class of the penicillin resistant, there is acid labile and acid resistant. Means these which are acid resistant under the class of the penicillin resistant, they are both, right? They are both the acid resistant as well as the penicillin resistant, right? That's the difference between the two. Okay, so if we talk about the acid labile, so it will the compound that are there in the acid labile, it is the methicillin and the nephicillin, right? And if we talk about the acid resistant, in the acid resistant, we could have what? The flucloxacillin, oxacillin, cloxacillin, and dicloxacillin. Okay, now coming onto the extended spectrum of the penicillin. So there are four classes: the aminopenicillin, carboxypenicillin, uridopenicillin, and amidinopenicillin. Right? Talking about the aminopenicillin, they are active against both the gram positive and the gram negative. So the example are ampicillin, amoxicillin, becamcicillin, telmepicillin, and pivacillin. Okay, if we talk about what carboxypenicillin, they are active against the pseudomonas, right? We know that the sulfonamide wasn't effective against the pseudomonas and anaerobes, right? The sulfonamides were active against what? The they weren't affected. They was affected by what? The sulfonamide was affected by the pseudomonas and the anaerobes. They wasn't in fact effective against both of them, right? So the pseudomonas could be targeted by the usage of the penicillin. Okay, and it is also effective against the proteus, but it is inactive against certain Klebsiella and the gram-positive cocci. Okay, so if we talk about the example, in the example, it would be carbacillin, ticarcillin, and carindacillin, right? Okay, these three would be the example in the extended spectrum under the class of the carboxypenicillin. If we talk about the uridopenicillin, they are also active against the pseudomonas as well as Klebsiella, right? So the example will be the mesolocillin, piperacillin, and pyrazine penicillin, right? So the PN is indicating penicillin, right? So it is what? Pyrazine penicillin, right? ऊपर क्या था? Piperacillin. यहाँ पे क्या है? Pyrazine penicillin, right? So if we talk about the next, which is the amidinopenicillin, it is highly active against the gram negative and the gram positive except the pseudomonas. So it isn't affecting what? The pseudomonas. It isn't affecting the pseudomonas, right? You have to use others to have an active response against the pseudomonas. Okay, so what are the example under the class of the amide new penicillin? So it is the mesillinam and the 5-mesillinam. Okay, so this is the two example of the amide penicillin, right? So if we come on to the mode of action, so before starting the mode of action, we all know that the cell wall, wait a second, let me draw. So in the microbiology, you have studied the structure of the cell wall, right? And you had studied that the cell wall has been synthesized by the alternating unit of NAM and NAG. What is NAM? An acetyl muramic acid. Okay, and what is NAG? An acetyl glucosamine. Okay, so you had studied in your microbiology that there is the cell wall has been synthesized by the alternating unit of what? NAM and NAG units, right? And the two chain of the NAM and NAG units has been attached by what? They are being attached by the usage of the peptide linkage, right? You had studied about that these two chain of the NAB and NAG units have been attached together by the what? The peptide chain. And the process that is used to make a linkage, which is the peptide link between the two chain of the alternating unit of NAB and NAG unit, it is performed by the transpeptidation reaction, right? By the transpeptidation reaction, the synthesis of the peptide linkage is done between the two chain of the alternating unit of NAM and NAG unit. Okay, so this was the basic that you should remember before understanding the mode of action, right? So now if we are going to discuss about the mode of action of the penicillin, so what does it do? So on the cell wall, wait a second. So if this is the cell wall, okay, and in the cell wall, there is what? Penicillin binding protein, the PBP. Okay, so in the cell wall, there is what? The penicillin binding protein. So what happens? The penicillin comes and bind to this particular site. Okay, and it bind to the penicillin binding protein. Okay, so when the penicillin is going to bind to the penicillin binding protein that is present on the surface of the what? The susceptible bacteria, right? So it will do what? It will inhibit the transpeptidation reaction. I had told you about the transpeptidation reaction, that the transpeptidation reaction is important for what? It is important for the formation of the peptide linkage, right? So if certain compound is going to inhibit this particular transpeptidation reaction, so obviously the cell wall synthesis will be going to be inhibited, right? So if the cell wall synthesis is going to be inhibited, obviously the structure of the bacteria is going to be compromised, right? So this particular compromised structure of the bacteria is going to hinder in the growth, in the division, in the metabolism, in all the aspect of the bacteria, right? So that's why the penicillin is a bactericidal, right? Because there won't be any cell wall, so there won't be any bacteria, because the cell wall is quite an important component for a bacteria, right? So it will prevent the peptidoglycan synthesis, and the cell wall deficit peptidoglycan made, and so it will lead to what? It will lead to the autolysis of the bacteria and lead to the cell death of the bacteria, right? So that was the mode of action of the penicillin, right? So you can have a picture over here about the penicillin. So here was the penicillin binding protein, right, in the surface of the bacteria, and the cell wall synthesis is going to be inhibited, which will lead to the what? Inhibition in the cell wall synthesis, right? And obviously it will lead to the death of the bacteria, right? Now as I had told you, several penicillin lead to what? Several penicillin light. I have told you about the procaine penicillin G. So what was the most common issue with the procaine penicillin G? It was the hypersensitivity, right? So what was the reason about the hypersensitivity? So what happened, that the penicillin sometimes it's going to be under degradation. Okay, so I had told you after the degradation by the beta-lactamase or the penicillinase, what it will lead to forming of? It will lead to the formation of penicilloic acid. Okay, so when there would be the formation of the penicilloic acid, so what happens? This penicilloic acid act as what? Hapten, right? You have to study about hapten in your microbiology, right? So when the penicilloic acid is going to be combining with what? With the host protein, right? When the penicilloic acid is going to be combining with the host protein after acting as in what? As in hapten, right? Because the penicilloic acid is going to act as an hapten, right? So this particular penicilloic acid is going to combine with what? It is going to combine with the host protein. And because we know that hapten is quite a small to get recognized by the host immune system, right? So to get recognized by the host immune system, the hapten should be bigger, right? So after combining with the host protein, the hapten is sufficient bigger to get recognized by the host immune system. Okay, so when it is going to be combining with the host protein, then it will lead to what? It will be going to be identified by the host immune system, and after the recognition by the host immune system, there would be the hypersensitivity, right? So that's why the reason of the hypersensitivity is. Okay, so but the hypersensitivity reaction is less common with the penicillinase resistant class of the penicillin, right? Like methicillin and all, right? So this was the reason of the hypersensitivity reaction with the penicillin group of drug, right? Now, if we talk about the pharmacokinetic property, you all can draw the pharmacokinetic property with the classification itself that I had taught you earlier, because I had told you about the acid resistant. Okay, I had told you which is the thermolabile, which is the acid resistant, right? So uh, it could be destroyed by the acid in the GIT. I have told you that there are acid labile, there are acid resistant. Like the acid labile was what? The penicillin G and the methicillin, right? And the acid resistant, I had given you a lot of example like penicillin V, ampicillin, amoxicillin. There were many, right? Okay, so the oral peak plasma concentration could be achieved in 2 hours by the acid resistant penicillin, right? And generally the penicillin is given through the intramuscular route, right? And we all know when there would be inflammation of blood vessel, they become more permeable, right? They become more permeable such that the content that is there in the circulation, right, it could pass through the blood vessel, right? It could easily pass through the blood vessel. Okay, so that's why the penicillin could cross the blood brain barrier, but only in the condition when there is meningitis, right? When there would be the inflammation of the meninges. But it could not cross the blood brain barrier if there isn't the inflammation of the meninges. Okay, so that's an important point. The penicillin can cross the blood brain barrier, but under a certain condition that there should be meningitis. Okay, that's what the condition is. Okay, so if we talk about the plasma binding protein, okay, plasma binding affinity, okay, of the penicillin class, so the ampicillin is about the 20% and the cloxacillin show about the 80%. Okay, if we talk about the excretion, so the majority of the penicillin is going to be excreted by the kidney, which is about 90%. Okay, and the major form is 80% tubular and 20% excretion through the glomerular route of excretion, right? So if we talk about, you had studied about the probenecid, I guess, in your pharmacokinetics, when you had studied about the pharmacokinetics, right? So when you had studied about the excretion part in the ADME, the absorption, distribution, metabolism, and the last, which is the excretion. In the excretion, you must have studied about the probenecid. What the function of the probenecid is that it acts on the tubule and it reduces the excretion of the penicillin, right? So if it will be reducing the excretion of the penicillin, so the obviously the T half of the penicillin is going to be increasing, right? So the presence of the penicillin in the blood circulation will be going to increase because the excretion is going to be decreased, right? So if the excretion is going to be decreased, then you should not have to give a repeated dosage of the penicillin if you're going with the combination of the probenecid, right? So if you're going to give probenecid along with the penicillin, so you don't have to repeatedly give the dosage of the penicillin because the probenecid is going to act on the tubule, renal tubules, and it will inhibit the excretion of the penicillin, right? So you could have a notice about that particular probenecid, right? And the synthetic penicillin, if we talk about the synthetic penicillin, they are also excreted through the bile. Okay, and we had told you about the penicillin V is getting destroyed in the veins, right? Now, if we talk about the clinical use, there are many clinical use. Okay, so it could be used in the treatment of the local and the systemic infection, right? The condition like bovine mastitis, anthrax, wrangle, black quarter, tetanus, lumpy jaw, and many more you can read over here. Okay, so these much condition could be cured by the usage of the penicillin. Now, there is an important point that about the units because the units are asked in the examination. Okay, so if I told you, no, if I tell you that there is a certain unit in which we look for that in the zero 0.6 microgram, in the what 0.6 microgram of what, of pure crystalline amorphous what sodium penicillin G. So the amount of antibacterial activity, that is being in the zero 0.6 microgram of pure crystalline amorphous sodium penicillin G, that is what one standard unit. Okay, so the amount of antibacterial activity that is there in the 0.6 microgram of pure crystalline amorphous sodium penicillin G. Okay, that's what is the one standard unit of penicillin. Okay, so here's the definition also, that one standard unit of the penicillin is defined as the amount of antibacterial activity that is there in the 0.6 microgram of pure crystalline standard sodium penicillin G. Okay, so if we talk about the units, it is also asked in the ICAR exam. So you can just note down that the 1 mg of sodium penicillin G is equals to what? 1667 units, right? You can learn these, right? So the 1 IU is equals to what? 0.6 microgram of sodium penicillin G, right? So these generally comes in the MCQ, right? So if we talk about the adverse effect, so in the adverse effect, you could have what? The hypersensitivity is observed. I had told you the reason of the hypersensitivity too, that due to the formation of the hapten, right? And there are, the observation has been made regarding the anaphylactic reactions too. And generally, when we are going to use the penicillin along with the streptomycin, which is an aminoglycoside, right? Okay, it is generally seen in what? The dog, cattle, and horses, right? And several platelet disorder has been observed, super infection has been observed. Okay, and there is a condition of hyperkalemia is also observed when we are going to give the rapid infusion of the potassium penicillin through the IV route. Okay, when there is a rapid infusion through the IV route of what? The potassium penicillin, then there is a situation of hyperkalemia could be observed, right? So the toxicity is seen in when the pig with the swine erysipelas is treated with the benzathine penicillin G when it is given what? Through the IM route. Okay, toxicity is generally seen with the benzathine penicillin when we are going to treat the swine with the what? The benzathine penicillin in the condition of what? Swine erysipelas, right? By the erysipelas. Okay, erysipelas, you know, right? It's, you had studied that in the microbiology. Okay, so if we talk about the IV of the penicillin G at high doses may lead to the neurological condition in the dogs and the cat, right? So that was all about the adverse effect of the penicillin, right? Now, I had told you about the beta-lactamase enzyme types, right? The penicillinase and the cephalosporinase, right? Cephalosporinase, I'll discuss it later in the next class. Okay, so there is also an important case, right? You have to focus on, right? So the beta-lactamase inhibitor. What are the beta-lactamase inhibitor? So when you are going to be in the clinics, right? So you are going to see that the penicillin class aren't going to be used alone, right? You aren't just injecting penicillin. You are injecting penicillin with a beta-lactamase inhibitor. Okay. Likewise, if we see that you had seen that in the clinics, okay, in the clinics, you must have seen that if you're going to give amoxicillin, right, if you're going to give amoxicillin, the combination of the amoxicillin is with the clavulanic acid, right? What is this clavulanic acid is? Okay, so let me tell you that the clavulanic acid, the sulbactam and the tazobactam, you are going to see these three beta-lactamase inhibitor. So what's the function of these particular three beta-lactamase inhibitor is that these particular acids that I had told you about, the sulbactam, clavulanic acid and the tazobactam, both of all of them comprises of what? The beta-lactam ring, right? All of them have what? The beta-lactam. So what's the purpose of combining the penicillin along with the beta-lactamase inhibitor is that this particular clavulanic acid, the tazobactam and the sulbactam, what they do, they will going to be sacrifice themselves. What are they do? They will sacrifice themselves, right? They will sacrifice them. For whom? They'll sacrifice them for the penicillin, right? So they are going to sacrifice their beta-lactam ring to prevent any degradation of the beta-lactam ring of the penicillin class. Why? Because the beta-lactam ring of the penicillin class is important for the antibacterial activity. So we wanted what? We wanted to prevent the particular beta-lactam ring of the penicillin by giving a substitutory compound along with the penicillin like clavulanic acid, tazobactam and sulbactam. Okay, we are going to give this particular three compounds to have what? To have the activity, right? That's why we add up what? The clavulanic acid along with the penicillin, right? So three types of the beta-lactamase we could have. One is the clavulanic acid, next is the sulbactam, and last is the tazobactam. So if we talk about the clavulanic acid, it is obtained from the Streptomyces clavigeneus, okay, and no own antibacterial activity. These three don't have any antibacterial activity, right? So the clavulanic acid is generally combined with the amoxicillin and the ticarcillin, okay. So the sulbactam, it is in semi-synthetic, okay, chemically it is similar to the clavulanic acid and combined with what? The ampicillin. The tazobactam is also similar to the sulbactam and combined with what? The piperacillin. That's why the combination of the beta-lactamase inhibitor and the what? The penicillin is used in the clinical uses, right? You could just observe by looking at the packages of the injections of the ampicillin and amoxicillin that they are combined with the what? The beta-lactamase inhibitor like clavulanic acid and sulbactam, right? Generally these two are used. Okay, so these are also known as what? The potentiated penicillin, because they are used in the combination to just potentiate the action of the penicillin, right? So the combination, if we talk about the combination, so the clavulanic acid is used with the amoxicillin in the ratio of the 2:1. The clavulanic acid and ticarcillin are used in the ratio of 15:1. The sulbactam and ampicillin are also used in the combination to have a potentiation reaction. Okay, if we talk about the penicillin that are injected with the sulbactam and tazobactam are administered through IV, while those penicillin that are there in the combination with the clavulanic acid are administered either through IV or through the oral route. I hope this particular penicillin topic is clear to you. So thank you everyone. Have a nice day. Okay.